All right, let's move on to the next sec. Talking about hate, man, I saw the title of this article that popped up in one of my feeds. I was like, oh my gosh.
I hadn't heard about this.
I have to hear about this one. So this comes from, you guys remember Sharon Stone? Sorry, I blanked on her name for a minute.
Mm-hmm. That's Ozzy Osbourne's. Is that her?
No, that's Sharon Osbourne.
Okay.
Sharon Stone was very, very, very famous in, when was it, the 90s? I think it was the 90s for a movie called Basic Instinct. Mm-hmm. Do you guys remember that?
I don't remember the movie, but I remember that part.
Are we going to see a picture
of
her?
Yeah, the part. Yeah, so, well, I just have a picture of her recently. She's 65 now, I think. So she was in this movie called Basic Instinct, and a lot of people I'm sure know what I'm going to talk about. So there was this scene. So she was kind of like a bad person in the movie. She was murdering people, and she was seducing them and killing them. It was a very sexual movie. And there's a scene where she's being questioned by the police, and she has her like legs crossed, and she's like in this little crop dress. And then she like uncrosses her legs like this, and she didn't have any underwear on. And that scene was in the movie, which at the time was kind of a big deal for a rated R movie to have something like that. And it spawned all of these, I mean, at the time they weren't called memes, but, all of these internet, people talking about it. So that, I don't know, maybe I'm sure she's more famous for other things, but that's how I always remember it from the 90s, because she was well known for that.
I feel like if I saw a picture of her from...
She looked actually very similar to her picture that we just showed, except obviously she was, 30 years younger.
Yeah. I don't know why I can't place her.
Yeah, she had short blonde hair, just very toned, very attractive. The movie was pretty good. It was just, it was kind of racy for the time.
Yeah.
Anyway, enough digressing about Basic Instinct. So I saw an article with Sharon Stone in it. She went into an interview, and she was in the news talking about this plastic surgery nightmare, and she said that she was really glad that her plastic surgeon was now dead.
Pretty serious.
I was like, whoa, what could have possibly happened where you would wish death on someone?
It's really
weird. So I looked it up, and there was a little bit of information about it, about what happened. She talked a little bit about it, but I couldn't find who was the plastic surgeon or any good details, because this actually happened in 2001. So in 2001, so I guess she was 40, 43 at the time. She was found to have some large benign tumors in her breast.
Yeah.
And so at some point, someone recommended that she have these removed, which, playing armchair quarterback, I mean, I'm not sure that was probably a good idea. I was trying to think what she may have had, and I think it is interesting to talk about, speculating, because it didn't say what it was. It just said benign tumors. So, one of the most common benign tumors of the breast is fibroadenoma, which is just a benign growth in the breast. But the thing is they tend to be pretty singular, and they don't always, or don't tend to be bilateral.
Okay.
And she had both breasts basically removed for these. So although fibroadenoma is really common, I don't think that was it. It could have been just cystic breast disease. I don't know if you guys are familiar. I mean, there are women who get this very dense cystic breast tissue, and doing what I do, I mean, I've examined a million different women breasts, and you do see it from time to time, and it can feel really, really hard. I mean, almost like unnaturally hard, and you can definitely have that on both sides, and so I think that's definitely a possibility. There's another one called pseudoangiomatous stromal hyperplasia, which is just a big long doctor word for kind of abnormal growth of breast tissue and blood vessels.
Okay.
That tends to be single side as well, so I doubt that was it, because she did have both done. And finally, the other thing is phylloides tumor, which is it's a benign tumor that can turn into cancer. They tend to be pretty big, but they don't tend to be bilateral.
Okay.
So I think she probably either had cystic breast disease or just very dense breast tissue, and someone recommended her to have that removed. I mean, of course, I'm playing armchair quarterback, but probably was not necessarily.
The plastic surgeon that died was the one that recommended to.
No, it wasn't the one that did it. Someone else removed these things. Okay. And so after she healed from that, she went to a plastic surgeon to get reconstruction, which is very common. It's very similar to people who get mastectomies for real cancer and go on to get reconstruction. And so it didn't go into a lot of detail about exactly what went down, but the gist of it was she went and saw a surgeon, and I guess they had a plan, and then she went into surgery, and when she woke up, she found out or instantly noticed that he had put breast implants in her.
Yeah.
And that was not something that they had discussed.
Oh.
So per her, and I couldn't verify this by finding the plastic surgeon, because apparently he's dead now, he
sad.
put breast implants in her without her consent. Now, if that's true, that is a colossal mistake.
Yeah.
I mean, that is not cool. In a lot of states that would be considered assault.
Yeah.
If you do a surgery on somebody they didn't consent to. So she was very, very unhappy about that.
Oh, they look better with these.
Well, that's exactly what she said. So there was a quote, and it said that and this is her talking. She said, "This is what he told me, that I did it to match your hips, and we decided it would fit your body better than whatever previous plan we discussed." And so, I guess, what really happened here? Well, I mean, it's only one of two things. I mean, one, the surgeon really went rogue and put in implants without.
I thought he was doing her a favor.
Right. It's a little hard to believe someone would do that, especially. I mean, not that you would treat a celebrity any different, but someone high profile like that to make such a really, really bad decision.
What they say.
Right. And so the other thing that it could be, and just to play devil's advocate and be fair, is it could have been poor communication between them.
Yeah.
You know what I mean? Because I this is one of my serious pet peeves with certain doctors, and when I was going through my training, I saw people do what I'm about to talk about, and it really bugged me. So I do the complete opposite. But there are a lot of doctors that'll come in, and so you're the patient. Oh, Sarah, you're here for breast reconstruction. Okay, cool. So we got a couple things that we can do. You'll be down for 4 or 5 days, but it's pretty easy surgery. All right, we'll see you next week when we do this. And there's not a lot of explanation of, okay, well, what exactly does that mean? Because the average person, if you just say you're going to do breast reconstruction on someone, the average person has no idea what that means.
Yeah, so maybe his breast reconstruction always include.
Yes, yeah, and to be fair, that's the most popular way to reconstruct breasts is to use implants. I mean, that is the most popular way, and so there is that possibility that in good faith he was doing what he said he was going to do, but he didn't explain it properly. Now, both options of what may have happened are still the surgeon's fault.
Yeah.
I mean, if it was the first one where he just totally went rogue and said, I'm going to do surgery A, but did surgery B instead, that was something completely different, not acceptable. I mean, absolutely terrible, that's malpractice and can be considered assault.
Yeah.
If it was just poor communication, I mean, still bad on him, but it's a little bit less egregious, I guess.
Yeah.
Because I guess I don't think she sued him for that.
Yeah, I'm like, did he keep practicing until he died? Did she ever get her implants removed?
I assume he didn't sue, and that kind of makes me think it was more the poor communication thing, because what may have been in his medical records is, well, patient Stone and I discussed reconstruction, which included these options.
Yeah.
Augmentation, tissue, fat grafting, or whatever. And so it was kind of listed out that maybe they did talk about it, but when actually verbally they were talking, he didn't make that clear.
Yeah.
So I think probably that's the more likely.
Yeah, I feel like that too, because it's like if you're doing plastic surgery on a famous person, it's like your work is going to be seen by a lot of people, and if you mess it up, they're going to say something.
Right. Yeah. So
if you do something like directly what they didn't want.
Yeah, if you do something the complete opposite of like what they agreed to, you're going to catch grief for that for sure.
Yeah, I could see that. It's the way you explained it.
So, with everything that we talk about, I always like to discuss if there is anything to learn from this. And I do think that there is, and I talk about this all the time, that having a good doctor-patient relationship is just critical. Mm-hmm. And that's what really bugs me when there are surgeons or other doctors that just kind of breeze through the room and it's like, oh, hey, you're going to have breast augmentation? Cool, we'll see you next week when we do it. I mean, that's not good relationship. If the patient doesn't understand what's happening to them, in at least some detail. I mean, they don't, need to know every step of an operation, but I mean, I do go through the steps of operation with patients, say, okay, this is what I do, then I do this, then I do that.
Yeah.
So that they at least have a basic understanding of what's happening to them, go over, recoveries, instructions, and it does help. I mean, very rarely do we have patients that come out confused or feeling like that something happened. I mean, I can't really remember anyone that came out and said, well, this isn't, what you told me it was going to be.
Yeah.
And that does happen sometimes in medicine. So, if you're picking a doctor, and this doesn't necessarily have to be a plastic surgeon, it could be any doctor, find a doctor that'll spend at least a little time to talk to you. Because it's better that way. I mean, I find that patients that understand things are more apt to be involved in their own care, and there's no doubt that those people have better outcomes. People who follow instructions, people that come to their follow-ups, like they're going to do better than people that just do whatever they want.
Yeah, I think that applies in like every part of medicine for sure.
And I do think it's the doctor's responsibility. Ultimately, it's the doctor's responsibility to make sure that patients understand things. So, I'm not going to put it on patients that, you're expected to ask these things. I do think it's good when people do their own research. I mean, I love it when I'm doing a consult and people are like, I have a list of questions. I'm like, oh, great. Well, let me, do my spiel and then anything I don't answer, I'm happy to answer. And a lot of times, because I've done things so many times, I usually will answer the questions. But it shows that people did their own research, they're involved with their care, and they're much more likely to get on the other side of things and have a good outcome.
For sure.
So, I thought that was pretty interesting, though. I've never heard anybody wish their plastic surgeon would die. I've heard people say that, they're unhappy, but that's pretty intense.
Yeah, I wonder if she got the implants removed.
I don't know.
Still,
it's a good question. Yeah, I wanted more information.
If she was that dissatisfied with them, I would think she would get them removed.
She very well may have. I mean, I don't know. That's an interesting question. I guess I could have dug up some pictures to see if it looks like she still has implants.
Yeah.
I mean, if she has any type of breast mount, she probably does. Although she could have had a tissue reconstruction. So,
sure.
Yeah, I don't know. It was pretty wild. I wanted to know more information for sure. I was trying to look up the doctor.
I wonder if the rest of her interview was sour and spiteful though. I wonder if
because
she was
of that,
in a bad mood.
Brought up bad memories.
Yeah, if if she was just in a mood.
I think it was an interview for a magazine. It wasn't a live one, or I would have watched it. And now I can't remember what it was for. Maybe I wrote it down. No, man, I didn't write it down. It was an interview that she was doing. I forgot. But yeah, I thought that was pretty interesting that she's claiming this doctor just did something totally not what they had talked about. And that and it may have happened, or it just may have been bad communication. I mean, and interestingly enough,
when was the surgery done?
2001.
Yeah, nobody even heard about it. Did it make tabloids?
I didn't find any news about it. No, she probably kept it quiet.
Maybe,
I mean, a lot of people don't want their bad experiences aired in public. The public forum.
Most people, yeah.
Most people.
Most celebrities.
So, but anyway, very interesting. I do think there are things to learn about this incident, and that is make sure you have a good doctor-patient relationship. It is important. You'll end up having better outcomes, and if your doctor is not willing to kind of meet you halfway and talk to you, then just find another doctor, period. I mean, there's lots of doctors out there, so find one that you're comfortable with.
Definitely.
Important stuff.